I am Juliana Quintero, a medical doctor and epidemiologist at the Fundación Santa Fe de Bogota, one of the main private non-profit health organizations of my country, Colombia. I have been working as a researcher for the past 10 years at the Public Health Division, conducting dengue research from different perspectives. I live in Bogota, the capital of Colombia, where Aedes is not present, and I travel every week to the municipality of Girardot to conduct all research activities. This is a municipality located in the southwest of Bogota, approximately 2 hours drive. It is a propitious environment for the transmission of dengue, chikungunya, and Zika. It has two seasons, the dry season between December and April, and the rainy season between May and October. Its population, it's over 105,000 people, that it triples during a high season of holidays. Regarding Zika, I want to first mention that Colombia has reported over 70,000 cases, making the second most affected country after Brazil. And in Girardot, the situation is the following. We have identified 1,936 cases in the local surveillance systems. Of these, 98% were clinical confirmed. 58% occurred in females. Being the first suspected cases was reported on October 23, 2015. The median age of the cases was 34 years old, and what we have identified right now that 16 pregnant women with Zika virus were reported in Girardot but are being followed according to national guidelines. By March 2016, 7 of them had given birth with no complications or microcephalia reported. 9 cases of Guillain-Barré syndrome have been reported. Lab confirmation is pending, and there are no deaths attributed to these viruses. One of the big questions has been if the emergence of Zika has changed the control methods. And I can say that the emergence of Zika did not change the control methods. Rather, it adopted levels around the awareness of the need to maintain and improve all the activities of control of vector control methods. And it has heightened the prevention strategies in the public agenda. What have we been doing in the community to prevent the spread of Zika? Well, we have been working in the past years to reduce Aedes population. We first just thought about dengue, but as it's the same mosquito that transmits different diseases like chikungunya and Zika, we focus our research in identifying options for innovative community-based system management interventions, including community stakeholders' participation and promotion of local leadership to guarantee long-term sustainability of interventions developed. We began first by exploring the ecological, biological, and social factors that can contribute to the increase of this Aedes population, and then moving to the design and implementation of tools and strategies that were most appropriate to the local conditions. And in this process is what possible to identify the most productive containers and target them with a cover made from insecticide-treated nets in an aluminum frame. The covers were designed and installed by the community members, and we initially proved that these covers, or that this measure reduces the pupa per index up to 71% compared to those containers that didn't have covers. Right now, we are scaling up the intervention to much larger areas, to thousands of households, with the intention to reduce the Aedes density, but more importantly, the disease or the incidence of the diseases transmitted by the Aedes aegypti. What is working so far with the measures or the control methods we are using? So far, we have demonstrated the efficacy in reducing the pupa productivity when we target the most productive containers. Literature have already evidenced that it is a cost-effective strategy, but when we develop it and think with the community and work closely with the community, it overcomes one of the most barriers we found when adopting this intervention, and is that when we are talking about sustainability. But additionally, we think we need more work to be done to impact the disease incidence. Regarding to what is not working, I think that more than thinking in what is not working, is why measures are not having the intended effect. There are several technical reasons for the ineffectiveness of the measures, and we can list some of them. For example, the development of resistance of larvicides and insecticides, the lack of appropriate control coverage, the poor oversight of field activities. Control programs are inadequate to urban reality. This means that they don't take into account the heterogeneity of the localities in the ecology of the Aedes, and the staff visits are not done often enough, for example. It is necessary that these programs have staff who know the social and economical conditions of the communities and can apply appropriate control measures within the community and with the support of them. There also is a lack of effective methods for entomological surveillance. Given there is a background of the other viruses in the community, how are the community members responding to the control efforts? Well, outbreak situations in general, as emergent problems, favors the mobilization of the society of all members of the community. I refer to local authorities, researchers, inhabitants, community leaders to face such a problem. It really represents an opportunity to strengthen the already known prevention and control strategies and to introduce new, effective, innovative ones. In general, it seems that the community wants and it's willing to work together in a multi-sector, intersectoral way. There is like a collective wish to adopt comprehensive strategies aiming to provide integral solutions to these complex, problematic vector-borne diseases. To effectively contain future epidemics, in this endemic municipality and other endemic municipalities of the country, I can mention that it's really important, or it seems appropriate, to suggest to review the objectives and structure of the vector control programs. It is necessary to deepen in the entomological knowledge to better understand the complexity and the heterogeneity of transmission cycles, that the control and the monitor must be a local activity that needs to qualified personnel and integrate scientifically based and context-sensitive control actions.